So apologies for being disconnected. There was a live issue. Can we quickly, I will just start off again introducing COVID Action Network. So welcome everyone once again to our topic for the day, where we discuss the experiences of the responses to COVID-19 in India and the UK. Today's ICANN conversation is with Dr. Leena Inamdar. ICANN India COVID Action Network is an initiative to help underprivileged communities that have been hardest hit due to COVID-19. It is a unique moment to combat the pandemic through an online platform that connects those who are in need of help and those who can provide it. Our COVID warriors work from home, activating their on-ground community action networks and mobilizing resource providers in order to connect the two and ensure that vulnerable sections of society can also sustain themselves through these difficult times. COVID warriors are spread across different states of India, steadily growing day by day. Till date, COVID has impacted almost 40,000 lives. I'd request you all as well to check out our website and definitely volunteer in whatever capacity as you can as an individual or as an NGO or an organization to make a positive impact. We'll quickly break into our COVID anthem. Do hold on, it will take about a minute while we start the screen sharing for the anthem.
मुश्किल है अनपढ़ी ये कैसी कठिन घड़ी सहमी सहमी जिंदगी बिखरी हुई बंदगी मानवता है पुकार रही दिखाएं हम दरिया दिली I can you can we can India can I can you can we can India can हम सब मिल जाएं तो मिलकर हाथ बटाएं तो टल जाएगी ये घड़ी झूमेगी फिर से खुशी आशा टूटे नहीं हौसला रूठे नहीं साथ ये छूटे नहीं मंजिल दूर नहीं मानवता है पुकार रही दिखाएं हम दरिया दिली I can you can we can India can I can you can we can India can
let's proceed with our today's I Can conversation on that positive note. I can, you can, we can, India can. I would like to welcome the renowned Dr. Leena Inamdar on board today. She's a senior leader and program manager with experience of working with national public health institutes, ministries of health, and development partners on health system strengthening and public health capacity building programs on global health security in Southeast Asia, Eastern Mediterranean, Africa, and Europe. She is a fellow and workforce lead of the Global Health Committee of the Faculty of Public Health UK, Chair Association of Blind Asians in Leeds. Her technical expertise lies in infectious disease epidemiology, communicable disease control, AMR surveillance, vaccinology, health security, and incident management and migrant health. She has leadership expertise in strategy and policy, public health capacity building, health system strengthening, translating evidence to policy, and workforce development. Thank you so much, Dr. Leena, for taking the time out today to be with us. And we look forward to a very fruitful conversation, and hopefully, there will be a lot of learnings and key takeaways today. So, I would like you to begin by sharing your experiences of working in India and the UK as a medical professional.
Thank you, Mandira. Thank you for the kind introduction. Good afternoon, everyone, and namaskar again from the UK. It's really a privilege to connect with the ICANN network, all initiated by young, enthusiastic sort of, the younger population in India. So it's really good to reconnect to my roots back in India, where I started my public health journey, started from working in the slums of Mumbai in Dharavi, which is now a COVID sort of 19 hotspot. So I can really correlate with what the experiences at the moment are happening in India. And thank you to, ICANN Network, the COVID network, for inviting me for this chat today. So as Mandira has mentioned, I'm a communicable disease control specialist and I started working and my journey in public health in India, and then moved to UK to specialize in infectious disease epidemiology, and have been working with the ministries of health in capacity building for improving the infectious diseases component of any country's response to global health threats. So Mandira, your question about comparing the responses between the UK and India, indeed, it's been a very interesting sort of time to compare and contrast and see, what are the similarities in the response that we can sort of see across different continents, across different governments, as well as also see what the differences are, and there's various reasons why these differences have to be there in the response. So just to sort of maybe relate a little story, not very long ago, I was traveling to Myanmar. I was traveling to Burma for a work mission. It was around mid of January. And as the trip finished and we were coming back, that this was on 30th of January, and traveling via Bangkok and Dubai, and we could just sense that apprehension at that time amongst travelers. Many people, that we were seeing wearing face masks, and on the day that we were in transit, the WHO declared initially a COVID-19 as a public health emergency of international concern. So since then, I've been following, the responses both in my role as a global health, public health specialist, and specifically directly supporting the COVID-19 response in the UK. I think there are some parallels, some similarities which we find in the response, between both countries. Things like the social distancing measures that have been put in place by the governments, the regular communication advisories. So we, like in the UK, we have, the daily briefings by the Prime Minister's office and public health experts talking. And likewise, I have seen in India as well, there are at state level, at the national central government level, there are regular sort of communications by the government, which is really key to keeping the common public informed. So measures like, I think the social distancing measure, definitely the emphasis on hand washing, which For years as public health practitioners, public health specialists, we have said hand washing is the single most effective, public health intervention that people can take at a personal level, to protect them from the risk of any infectious disease. So again, it's good to see, the emphasis on the basic sort of public health preventative measures. The other things, like protecting the most at risk, again I see that the Prime Minister in India as well, Shri Narendra Modi ji, when he first addressed the nation, he did mention there are certain population groups that, say over 60, or people with other conditions like diabetes or heart disease, need to protect themselves particularly, and keep away from those who are infected. I think, so there are some commonalities in terms of the measures, the things like the border control, and the I think in India, in fact, we were more proactive in instituting immediate sort of travel bans, and stopped issuing visas to people to travel to India, and stopping travel in India. I think those were similar measures, like in the UK, the social distancing was introduced. I think if I have to pick up, like, what are the differences or in contrast, then the way these measures were implemented and the speed at which they were implemented, um, and the reach out to support perhaps the most socially vulnerable and those already disadvantaged, I think that is probably a stark difference I can see. Because in India, obviously, we needed to be proactive given the population size and our systems, and the capacity to cope and manage the infection. We needed to really implement some measures at pace and at speed, but that was perhaps at the cost of a disproportionate impact on those who are already socially very vulnerable, the migrant populations and people in the slums, for example, and particularly the migrant workers who perhaps were caught unawares of like what is happening. And I think perhaps better planning, a bit more staggered sort of implementation of those measures, better communication, and perhaps a bit more early thinking on how we can support and offer social protection and perhaps financial protection to those who are at greatest risk. The other thing also I would like to perhaps mention is the emphasis in the UK has been very much on protecting the NHS beds, and making sure that those who really are critically ill, need ventilators, and need critical care, there is capacity in the system to do that. Now, this is because, obviously there is a certain group of individuals, which we'll touch upon perhaps later, who are most at risk clinically from, COVID-19. And whether that emphasis has been, given due importance in India. And I can touch upon those who are more at risk clinically. And perhaps that may be something to think about in the differences, how, we have given the risk communication messages.
Right. So you have actually shared a lot of interesting insights already. So I would like to dwell further into what you mentioned in terms of what could be done better, say timely communication and effective measures taken in advance for the underprivileged section of society. So just to elaborate on that further, what do you think that the Indian government has done right and which has really worked for India in this scenario, and what could be done better?
Yeah, so I think, as I've mentioned, there are a number of measures that the Indian government took very rapidly. And I think quite early on in India, the airport screening was instituted, which is really important when you are in the initial sort of contain phase. So all the major airports, they had, fever screening for COVID-19 symptoms. And obviously, as everyone will remember, the science was still developing in terms of what are the symptoms. So the basic symptoms of like how you screen people, and what symptoms to look out for. So I think that, border sort of airport screening was instituted quite rapidly in India. That's definitely commendable. And then The other thing that I think personally worked very well in the initial part was the contact tracing. So those who were returning travelers were traced and their testing was done and they were put into quarantine and isolation facilities. And I think that initially that response was quite impressive. I think, as I've mentioned before, the almost total lockdown, stopping the interstate travel in India, because obviously there's so much of like travel in between, cities, and particularly then that means sort of blocking the potentially hotspot areas. I think those measures really worked well. I think a couple of examples I would particularly like to highlight is, we know that in Kerala, so because obviously India is such diverse, and every state health has its own, health system. And one of the best public health systems is in the state of Kerala, and they have a lot of experience, managing previously outbreaks like the Nipah virus, and very well developed sort of public health infrastructure. So their measures of, trace people, contact trace, and then test them and put people in quarantine very rapidly is one of the exemplary sort of, measures that we can sort of learn a lot from. So I think, there are certain models of, say, best practice which have been implemented, across India. The government set up task forces on, I was reading recently that there are task forces on now vaccine development, on the epidemiology and surveillance, people looking at research. So again, that's a proactive step that the government has taken under the, the advice of the Indian Council for Medical Research, so ICMR, and other national bodies. So I think there are some very positive steps. The important thing was to put things in place at pace and speed, and communicate to the, the population of India rapidly. And I think those things did work well. I've also read examples like, some of the states like Maharashtra using drones, for example, to monitor, the contact tracing and the quarantine measures. So again, there are some very unique, perhaps innovative approaches that have also been trialed out in India.
Thank you for discussing that. Now we just a lot of people, in fact, from our audience also want to know that, how effectively is social distancing being implemented in the UK.
Yes. Okay. So very happy to talk about that. And this was one of the actually guidance that I personally worked on as well. So as people know, on the 23rd of March in the UK, we implemented, the social distancing measures. And it was basically not really a guidance, but it was the government's instructions. So there's a nuance in the language, like, when you issue advisories and guidance, then people think they have a choice to follow or not follow them, whereas the instructions in the UK was very clear that people must follow this guidance. Although when in the initial part there was in terms of the compliance, it took a little bit of time to keep reinforcing the message. But essentially, there were three key measures in terms of social distancing, and that meant that everybody, when the lockdown was enforced and implemented, everyone was told to stay at home, whether they had symptoms or not. And this included, closing down the schools as well, closing down restaurants, pubs, public spaces, etc. And then everybody was basically instructed that wherever possible, people should work from home and avoid all non-essential travel. And then the other sort of practical things like, obviously people need to go about their daily, they need to make sure that there is, food in the house, and they get their daily sort of essential supplies. So there were lots of support measures put in place for people who could not themselves, access these, because there are many people, particularly UK has a significant proportion of elderly population groups. So they cannot go out on their own. So there was an army of like volunteers set up, and the local councils. So like if you compare the municipal corporations in India, they have what is called local resilience forums, and they started, contacting the people who could not really go out on their own and get their supplies. So essentially, it's the reinforcing of the messages, people really continuing to stay at home. In the very early part, obviously there was this stay at home guidance where people were told, if you, so once we moved from the contain phase in the UK to what we call the delay phase, when it was evident that there is now widespread local transmission happening in the UK, then then the government on the 13th of March moved to the delay phase. And at that point, all these strict and stringent measures started to be implemented. But as I said, they were implemented in a staggered way. So the government gave people notice of like how this is going to be implemented. And essentially, people had some time to plan for how they would manage perhaps the next few weeks. And the some of, like, just an example, I have a card that was delivered, and every single household in received this card, where one side is black, one side is red, and the other side is green. And because many people say live alone and they don't have much support in the UK, so people were told that if people are all okay and they're managing, then you put the green side up of the card on your window. Whereas those who may be struggling because they're social distancing, people cannot knock on the doors of their neighbors and find out, how you're doing. Then you put up the red side of the card up in the window, so that passerbys and neighbors can watch out for each other. So there are some very small practical things that the UK government did in help, putting up these sort of social support measures, which really made a difference in improving compliance in the UK. And then obviously, there was an advisory for people who were symptomatic to strictly stay at home, their households to be isolated for 14 days. But that was all mainly on voluntary basis rather than enforcement basis.
So that's pretty interesting that the quarantine was as well on voluntary basis than enforcement basis. And it was very interesting when you mentioned these simplistic measures like that card, which sounds so simple but works so practically in such a situation. So I think the social effectiveness of dealing with this pandemic is extremely important for all governments across the world. Another question that we are very curious about is could you share your observations and what exactly is the shielding policy in the UK? What are some key lessons and takeaways for India and the rest of the world as well?
Thanks, Mandir. I think that's a very interesting sort of observation. And you've mentioned about the shielding policy. This is a policy to protect the people who are defined as clinically extremely vulnerable. So, we all are susceptible to COVID-19 because, it's a new virus. Nobody has any antibodies and we are not immune to it. So essentially we are all susceptible. But generally, for say majority of the population groups, it will likely be a milder form of the infection. But there are, unfortunately, there is a segment of our population, some groups that have some certain clinical conditions that make them really at very high risk of severe illness from COVID-19. And what happened in the UK was, as the government advisors, the expert clinicians were observing the early cases and severe critically ill sort of patients, they realized that there is a group of patients who need to be protected, as so-called shielded, or we were referring initially to it as cocooning as well. Like these people need to be really cocooned and shielded from others. And so the UK government, because every patient is registered with the general practitioner here in the UK, so it's every individual has a unique NHS number. It is then and then there are disease codes that are put into the electronic systems in our health records. So it was possible for the government and the NHS to extract information for all of these individuals. The experts came forward to define a list of conditions like people receiving immunotherapy, for example, cancer patients, people on, say, who have received organ transplant, people with kidney disease, for example, those who have, received regular dialysis, or pregnant women indeed, who have some heart conditions. So these were observed to have a more significant impact of COVID-19. So the government very rapidly introduced a shielding policy where these individuals were basically told, you must not leave the house at all. And then even if they are living with other people in the family, ideally, if possible, if there is a separate room available, then these people should really be staying in that room, mixing as less as possible with other members of the family. It sounds draconian, and on a personal level, when actually helping to draft this policy, it was quite in fact emotional to even think of, like, we are advising people to shield themselves for like 3 months, 4 months period. But it is extremely important that the message gets across that these individuals need to be protected. And because as we are learning more that this infection is also likely to spread from the pre-symptomatic and asymptomatic, so people who have not yet developed symptoms or very mild symptoms. So minimize any interaction with family members, where there are common areas in the house like the kitchen areas, for example, or the lounge. So these people, as much as possible, should not really come and interact with other members of the family who are perhaps going outside and for, say, buying the essentials. So and in fact they were told, like, obviously we need to balance the risk communication with the well-being as well, because these are extremely challenging and stressful times for everybody, and particularly for those who are living in that fear of them being defined as clinically vulnerable. If they take, and they and their family members together take certain measures, then at least we are buying time until perhaps we have a vaccine, for example, or maybe some discovery through drugs, etc. So the shielding policy is a very stringent policy introduced by the UK government. A letter went out from the NHS to about 1.5 million people, asking them to shield themselves unless they so minimize and basically avoid any interaction with their family members. If they do depend on any carers, so somebody coming and providing care for them, or if they're living alone and they have to do work for themselves, then minimal contact with those people. So there are very strict policies to and advice and guidance given to these people to basically stay away from and avoid any sort of face-to-face human interaction. And that's essentially to protect those, because they are being observed as being at greatest risk of very, very severe illness from COVID-19.
Right. So I think what you said initially when you spoke about the shielding policy is that in the UK, everyone is registered with their medical
Yes.
practitioner. So it makes a huge difference in times like this to have that kind of a system, because only then can you actually identify the clinically vulnerable.
Sure.
And while the policy may, like you mentioned, sound a little draconian and in theory, it is what we need to do to ensure protection of these vulnerable identified people.
Yes.
So I think in India, probably we still have a long way to go to actually have that kind of record and database to effectively do that. So probably something like a mass lockdown is what we need to look at in India in this stage, probably.
Sure.
Uh, so the next question we would like to know is regarding herd immunity. So like even the UK initially was discussing herd immunity, and countries like Sweden are also exploring that option. So what is your observation regarding this?
So, I mean, obviously, there is a lot of interest in this concept about herd immunity, which is usually used in the situation where in vaccination programs, where we vaccinate a minimum number of people so that those who are basically either cannot have the vaccine or not able to mount a good response, immune response, because of, say, underlying conditions, they are also protected, because essentially we bring down the circulating sort of infection rate in the community to such a low level that the transmission rates are reduced. Now we have to remember that the coronavirus, COVID-19 virus, is a new virus. We yet do not know a lot about it. There's lots of unknowns and uncertainties. For example, we do not know how long an immune response even will last in an individual, and whether there are any emergence or, say, reinfection cases, which are also being studied in some countries. The concept of herd immunity, again, if people get exposed and then they develop the infection and then they become immune, and that's essentially, then they can go about their business in a sense. And that is something definitely all governments are exploring, as is could this be used as a exit strategy, for example, from the lockdowns. Now the only way we can perhaps, in my view, authoritatively and categorically find out how much of your population is actually infected is through testing. And testing for we are talking of testing for infection, but also testing for the antibodies, and that means like what we call as seroprevalence studies, where people, the blood sample is taken and tested to see whether they have developed antibodies for the virus, and then that means people can be um, told that you're immune or not. In this situation for COVID-19, I think there are lots of still unknowns about the validity and the sensitivity and what we call the predictive value of the testing. And therefore, I would take, at the moment, for the antibody test, we still don't know enough whether those tests are reliable and give valid results. So that again is something that is a challenge to all of us as public health practitioners. I think the herd immunity concept, yes, it's linked to the concept of flattening the curve, as we are all hearing. And if we are able to keep that infection level to a situation where perhaps one person infects, less than one person, and that's the basis of this, the transmission dynamics and herd immunity. And if we get to that stage where, say, for example, in swine flu in 2009, we had the herd immunity, we had the, what we call R0, is how many individuals in a susceptible population does one infected person, infect. And that was roughly around 2.3 for swine flu. Now we are seeing in the COVID response that there are different, there is difference in the regional sort of behavior, in a sense, for COVID-19, perhaps due to population density, due to compliance to the social distancing measures. And therefore, some regions have achieved what we call the R0, less than one, meaning the ability of the infected person to infect others. If it goes down to below one, then we have achieved success in our control measures. But that's not uniformly being observed in all regions, in all parts. So the balance is achieving that level of herd immunity in the population where we can say perhaps those at less risk from COVID-19. We know that generally younger population groups are getting a milder form of the illness. And therefore, maybe, though there has to be a balance between how can maybe the economy start in a way that we allow certain population groups to carry on, and start, at least, getting back into some form of normalcy, whereas protecting the most vulnerable. And I think that balance is hard to achieve. And that's where I think, more data on how is the virus behaving in different populations, the immunity that we are achieving as a population versus immunity in individuals, I think is going to be quite interesting and obviously very critical, which is linked to the policy to ease down lockdown. But in terms of the as a strategy to develop herd immunity is not something that we should aim for. Herd immunity will happen as part of our, response to the pandemic. As there are people who are, eventually we will have to have measures for people to come out of the lockdown and start going about the normal business as much as we can. So it's something to sort of watch for. As a strategy, it is not something, certainly as a public health person, we would advocate that people, governments, look at that herd immunity as a strategy. That will come as part of your control measures.
Thank you so much, Dr. Leena, for taking us conceptually through the concept of herd immunity, because there are a lot of opinions floating around this, and there's something new written about this every day. But I think because you explained it to us from scratch, I think a lot of us are happy, and our audience members are also glad to get clarity on this concept. The next issue I'd like to touch on is the added issue in India of the migrant labor crisis. So, as a health professional and health expert, what measures would you suggest in terms of policy as well as medicine to ensure that these people are kept safe and healthy?
So I think you've touched upon a very important concept of inequality, because obviously all the work that we do, the focus of all public health interventions, making sure that those who haves and have nots, there's a big divide between that. And even going back to your foundation of the concept that ICANN started with, the help seekers and help givers. And this gap and this inequality is something that keeps really is something very passionate for public health people. All our work is focused on addressing that. So it's very what should I say, sometimes quite upsetting to see at the moment, the huge disproportionate impact on the migrant workforce and the migrant people in India who basically are dependent on daily wages, for example, for their livelihoods, who migrate to these urban areas and live in the most challenging conditions, like Dharavi, for example, I mentioned, or even other slums or urban areas in India. So I think we have to make sure, and there's a double disadvantage for these population groups because of poverty and illiteracy and not having access to the right information. So I think those, there has to be a multi-pronged sort of approach to, supporting such people by certain social protection measures. So I was reading about India, and the government has now introduced some packages of financial and social protection schemes for such, disadvantaged population groups. But is that enough? And whether there is something that people at grassroots level can, actually make it easier, so that there are certain, say, we have to think laterally whether this workforce can be trained to perhaps indeed support the COVID response themselves, educating them to make sure that they are first of all given economic sort of cover and social protection through financial means, but also empowering them to join this fight, because we rely on and I'm thinking like at the very front line, say in the rural India, the sub centers or the primary health centers and say Anganwadis, for example, where these people come from such villages, and whether they could be used, they could be sort of empowered, skills could be imparted, so we use their skills in fighting against COVID. I think it, as I said, it's a multi-pronged sort of approach of social protection, financial measures, giving them the right information at the right time, and basically also, making them empowered so that they can at their level, perhaps in their villages, in their mohallas, how they can spread the message about the COVID-19. Because if this if the mass sort of migration, many of these people are used to how things work in city, for example, and therefore, using those links, whether they can be used as advocates and champions to spread the message around. But I think the main thing is, for those people, the first priority is their daily living, and if that is addressed, I think we can look at other things later.
Thank you, Dr. Leena. I think a lot of us also sitting at home are constantly worried about this and feeling anxiety because we see this on the news. And like you mentioned, it's really a collaborative effort, and people who, the have-nots, the haves coming together and driving this together. I hope people also log on to our website, Cohen Action Network, and feel that they can also be a part of this movement to make a difference. Our next question is, how long do you think this will be the new normal? And we actually have a related question from our live audience as well regarding that. The recovery rate in India is 20%. Looking at this recovery rate, can we say India is winning the battle against COVID-19 and will be returned to normal soon? What other countries are also in a similar benchmark?
Yes, and I think this is on everybody's thoughts at the moment in terms of, we cannot really stay inside the house and continue like this forever. So we have to obviously start thinking about how, and governments are doing this thinking indeed, of how we can make sure we ease some of the stringent measures to allow certain parts of the economy to start. So how long this new normal? I think the virus is not going away anywhere anytime soon. Um, we um, we are all hoping that with all the different drug trials and vaccine trials, that there is going to be a vaccine somewhere on the horizon soon, but unlikely that it's perhaps going to be available for at least another 9 to 12 months, I would say. Uh, if it comes earlier, I know there are a few trials which people are really hoping, like in the UK, there's a Oxford vaccine trials group has just started the trials in the US as well. So we have to learn to adapt our way of living to this virus. And it means that, sometimes it feels as if we are almost going back to the basics in terms of our messages about hand washing, hand hygiene, the sanitation messages. They have always been there. I think the COVID-19 has just brought them again back into, the limelight, that we should never forget our basics. And I think we have to learn new ways of living. I think the social distancing measures are going to be around for some time, even if the stringent lockdown is slowly eased. And I think governments are tackling it in different ways and looking at maybe putting zones in. I think in India also they are doing like the cluster containment, so the red zones or the hot spots and the green zones. And governments are thinking along these lines everywhere. But there will be some form of social distancing that I think will stay for longer. So schools, for example, when they start, they'll probably have to keep that 2 meter distancing rule in place. When people go to workplace, again, there'll be a lot of emphasis where, and if possible, people to work from home. But if not, then, and if people have to be there, then avoid big gatherings. Make sure that the workplace distancing rules are followed. I think airline travel is going to be interesting because, how do you implement the social distancing in a, airline air travel? And, some seats perhaps will have to go empty and keep that distance. So it's going to be a very different way of living for at least another 6 to 8 months, I think, given what we are experiencing. And then as we slowly, because in the lockdown, many people are not getting exposed to it, obviously, and some people should not be exposed to it, as we talked earlier. But those who are generally fit and healthy, and start to pick up the normal business, we are, people are going to get infected, and then, slowly developing that level of immunity. How long that lasts, we don't know. So again, lots of unknowns, but it is going to be a very different way of living and working for some months to come, at least, even if the strict, mass lockdowns would have been lifted.
I think we are all handling these uncertain times, yet it can still be interesting in the next 6 to 8 months with a lot of evolution in the medical profession and new discoveries to combat this virus. Uh, the next point that I'd like you to discuss is relating the key initiatives taken by the NHS and the public healthcare system in the UK. So, what are the key initiatives, and are there any specific public healthcare takeaways that you think could be implemented in India effectively as well?
Yes, so I think specifically for from COVID experience, there are few lessons for all of us to learn. Certainly, lots of lessons in the NHS and indeed likewise in India. There are positives in the UK response, where, as I've sort of highlighted, how the general sort of support measures, the support systems, care of the elderly, care of the vulnerable, those who live alone, that has been a real sort of, positives in the UK response, where the local governments have been fully supported by the national governments. And there are different infrastructures in place, like there are local resilience forums, for example, in the UK pandemic response, and they regularly test the pandemic response. So there is always an exercise and drill and lines of communication, coordination, roles and responsibilities of various agencies are well sort of chartered out. Now, the initial emphasis in the pandemic response, from a public health perspective, was during the contain phase, was identify every case, test is each case, and those who were positives, then they were obviously told to isolate at home, and their family members were told to isolate at home for 14 days. Along with that, there was an emphasis of the returning travelers, for example, from hotspot countries, or those who were stranded on cruise ships, for example, and were exposed. Those were then kept in government quarantine facilities. As we moved to the delay phase, there was less emphasis on the tracing each individual who was symptomatic and testing them, because the testing had to be diverted for those who needed to be tested, those who were at greatest risk. So I think the it's useful to learn from that experience, in a sense that in the UK, the public health and the clinical response from the NHS go hand in hand. So we work very closely. I used to work in a health protection team at the front line, at a district level, at regional level, where we work very closely with the clinicians in the hospitals, with the microbiologists, for example, and our response is tied hand in hand with the clinical facilities. I think that has been always a feature in any sort of mass outbreak response in the UK, whether it was the swine flu pandemic in 2009 or the SARS, coronavirus SARS 2003. And I think that's something that from an India perspective, and I have worked in India not very long ago, 2014 to 2016, I was working with the Ministry of Health on vaccine policy, and then with the US CDC on health security in India. And one of the things that strikes me is that we perhaps need a cadre of workforce which has trained in health protection and communicable disease control. So the training that we receive here in risk assessments, contact tracing, outbreak management, I think that is something that is there in India, but spread across and not as part of one single institute necessarily. And at the moment, I was reading in the news in India that many state epidemiologist positions are vacant, and perhaps, and the government is looking to sort of employ more epidemiologists. So I think this is something clearly very much a need for developing our own, skills and expertise in health protection, in communicable disease control. And I think that's where young people like you from the ICANN network, as you are thinking about your career choices, I would strongly encourage people to think about public health as a career. When I came into public health, more than 25 years ago, uh, and I chose it, when I had the choice to do other specialities. And still, it is perhaps not necessarily thought of as a very sought after field. And I think that's something that we need a culture shift and a shift in the mindset of the people. And COVID has highlighted how much there is a need for good public health infrastructure and also investment in the health system in India. So I think, in terms of wider issues, I think we could perhaps do much more in terms of pandemic preparedness and developing that cadre of professionals in India.
Thank you so much for that message, and I hope a lot of us are left inspired to pursue meaningful careers which make a difference in the public space, especially in public healthcare, like you spoke about. Uh, the next question that I think a lot of the audience members are also mentioning is either say what happens once the lockdown ends. Do you see the cases spiraling in India? And a lot of people are also asking that how do you think the future will look for us?
So it's hard to tell, and if we had a lens into the future, I think that would make everybody's jobs very easy, and that's not how life is. So I think we just have to wait and see how it progresses in India. I think I was just reading a recent Lancet article. And they have commended, India's response, the early sort of lockdown, travel bans, border closures, etc. So how does it look like in future? I think the future is going to be quite different, in all respects. And we all have to sort of learn to contribute to how we can, help in this response in whatever way we can, be it just spreading of the message, supporting our families, looking after our families and taking care of them, um, wherever possible, volunteering like you are doing. I think there's a few things. What will future look like? I don't have a crystal ball to answer that. I think it's just learning to cope with a new way of living for the coming months, and doing every bit that we can to try and contribute to this response. Learn from it and see how we can take the learning. It's a lifetime of learning. I think it's an unprecedented situation that people have never dealt with in their lives before, in their careers before, and so it's a totally different sort of ball game. So I don't know if I have answered your question as such, but it is, I think, just something we have to learn to cope with in the near future.
I think the sentiments you expressed more or less did answer the question and gave us hope. We should all remember that we are in this together, and like you said, it has to be a collaborative effort from all of us to tackle this together. Uh, with that, on that note, I would request you to share your closing remarks for today's ICANN conversation, please, Dr.
Yes, so I think it's been very interesting, chatting with you, and definitely, just as a summary, I think obviously my main message is in India, because of the measures perhaps that have been put in place, despite the challenges we have in terms of our population size and the population density, for example, and the variation across different states in terms of how the systems are. So far, touch wood, fingers crossed, we have managed to keep the numbers low, although there could be an element of underreporting or under ascertainment, so we may not be counting every case. But having said that, I think still it's quite impressive that we've managed to keep the numbers low. We have a higher younger population, and because we know from the science and epidemiology that those are the perhaps the least affected at the moment, which means there are opportunities, for the younger people to come forward and to contribute to this fight. I think the lockdown is having already a desired effect in trying to flatten the curve and maintain the system capacity to support people who need healthcare the most. So just 2 or 3 messages. Again, I would perhaps use every opportunity as a public health professional to raise the importance of, hand washing and maintaining the hygiene, and sanitation messages are already being sort of shared widely. So just sticking to that itself is a big thing that people can do to, minimize their risk of getting, exposed to COVID. And then all the measures that the government is putting in place, like the stay at home, looking after your elderly, parents, grandparents at home, maintaining the nutrition, and physical activity as well. So just encouraging, maybe your grandma at home, staying in a flat or in the house and not going out anywhere, encourage them to do simple stretching exercises. So I think we all can do our own little bit to look after our families first, and then also to make sure we can, learn from what is happening. And we're all, collectively, the power of, collective sort of efforts is huge and shouldn't be underestimated. So like you're doing through the ICANN network, to come forward and, contribute to this in any way we can. But simple message: stay at home and wash your hands frequently. I think that's what I would like to end with.
Thank you so much, Dr. Leena. I think those messages will stick with us, and we'll all ensure daily hygiene as well as activeness in our daily life. And we hope that we get to collaborate further and make a huge impact. Thank you so much once again for taking out your
Thank
precious
you.
time to join us today. It has been
Thank
a
you.
wonderful discussion.
Wish you all the best. Thank you.